Thank you for connecting to this webinar. We hope this will be an interesting hour of sharing experiences and insights. Thank you. I hope everybody can hear us all right, and that you can see the screen. Excellent. If you have any issues, my IT team tells me the first thing to do is tell people to try log in again. So any issues, please do try again. Excellent. Okay, well, we're going to kick this off. Welcome, everybody. My name is Shani Winterstein. I'm the Director of Capacity Strengthening at the Global Health Advocacy Incubator. The Campaign for Tobacco-Free Kids and its initiative, the Global Health Advocacy Incubator, uses the power of advocacy to reduce preventable deaths and to improve health at scale by changing policies and strengthening systems. We support civil society organizations and advocates in more than 40 countries around the world to pass public health policies that save lives, reduce disease, and prevent injuries. In 2024, we launched our Advocacy Action Guide. The little logo on the bottom of the screen will show you that, which is a resource that we use and we wanted to share with the world in terms of best practices for public health advocates on planning, organizing, and implementing effective advocacy. It documents best practices and our collective experience, includes templates and examples to inspire and give people some ideas. We are so excited today to launch the complement to that, which is our guide, our Research for Advocacy Action Guide, a worthy addition to our collection. Today, I'm going to be joined by some amazing colleagues from around the world who are going to be talking to us specifically about what is in this Research for Advocacy Guide. Meg Riordan is our Vice President of Research for our Tobacco Control Program in the USA. Hi, Meg. Munawar Hussain joins us from our Food and Nutrition Program. Dr. Anita Kaluba is joining us as our Tobacco Lead in Zambia, and Julianne from our Overdose Prevention Program in the US. Now I'm going to hand over to my colleague, Meg, to kick us off and talk us through the actual guide. Hi, Meg. Over to you.
Hi. Thanks, Shani. Thanks so much to everyone for being here this morning. We're excited to launch this Research for Advocacy Action Guide. I'm really happy to kick off the conversation. This is work that's near and dear to my heart and near and dear to the heart of my team, because this is the kind of work that we do day in and day out on the U.S. tobacco control program at Tobacco-Free Kids. The Research for Advocacy Action Guide was really a team effort. It was a collaborative working group across units at Tobacco-Free Kids. That's the U.S. Tobacco Unit, the Global Tobacco Unit, and the Global Health Advocacy Incubator. We came together to talk, kind of brainstorm insights and tips and think through how we do our work and what did we want to share with the broader field and in the community working on public health issues across the globe. So the purpose of the guide is to demonstrate how we incorporate research and data into our issue advocacy campaigns. We define advocacy as policy advocacy in this guide. And the action guides really outline the key phases of policy advocacy, the key phases towards achieving health policy outcomes. We hope that the action guide is a helpful tool for the field, for our colleagues, for partners, for advocates working on a wide range of health policy issues. So, data and research is incredibly important to the policy advocacy process. It's relevant across all of the public health issues that we work on. Research can bring attention to the problem and solutions to address the problem. Research can educate decision makers and other influentials, help to persuade them to support the policy that you're working on. Research can help build relationships. It can increase, set up a broad base of support for the issue, diversify support for the issue, strengthen support for the issue, all really important to moving a policy agenda forward. And finally, research can help you bring much needed information that can help you sustain a drumbeat or sustain attention to the issues that you're working on. So using research throughout a policy campaign can really enhance your ability to reach key audiences. Really important, this research can help you counter industry opposition that you might face. And ultimately, it can help you achieve policy success. And so the guide is organized into 5 sections. And like I said, the collaborative working group, we came together to talk about, what are the tips? What are the how-tos? What are the strategies that we want to share with folks? What do we do? What is practical guidance that we think is important to really help people in the field incorporate data and research into their campaigns and help them achieve success? And so the 5 units are: serve as an information resource, provide technical assistance to governments, package and disseminate the research, conduct original research, and build relationships with researchers. And like I said, each section has some tips and tools, but they also include some case studies. And we're fortunate this morning that we're going to hear about some of those case studies that are included in the guide from people right on the front lines doing this work. So the first piece, I'm just going to talk really high level about what are some of the tips and what are some of the pieces of information included in each section, and then we'll turn to the case studies. So the first section is serving as an information resource. And this is really one of the best things you can be, an information resource. You really want to set yourself up, set your organization up as the go-to source for information on the issues you're working on. You want to have the latest data. You want to have credible information. You want to be able to provide analysis. What are the key takeaways? What are key findings? What are implications of research findings and data on a specific issue? And the guide explains how you can do this. Some concrete tips for doing this include staying informed on the latest science, maintaining the most up-to-date data in your materials, providing data and research in a compelling format, easy to understand language. And then, another tip is, you want to respond to requests for information in a timely and thorough manner. This is really important and can help you establish relationships with journalists, with policymakers. Once they see that they can rely on you for credible information, they get it in an understandable way quickly, they can put it to use and they will keep coming back for more. And that's really a way to make sure that help you frame the issue and helps you influence the policymaking process. So the second section is all about providing technical assistance. And this is providing TA directly to government officials. Through TA, we can help decision makers in implementing agencies design policies and regulations in a way that will have maximal public health impact. And so, for example, on the tobacco tax work, we bring our own expertise and the expertise of researchers that we work with directly to, finance ministries, health ministries, policymakers, and we provide information to help them design the policy, like I said, in a way that's going to maximize public health impact. And often, because of our expertise, we have a much more in-depth knowledge on the issue, and that can be really a valuable resource for governments. So don't sell yourself short, get yourself involved in the process. And another way that you can provide TA is when governments request public comments when they're considering changes or policy actions, regulatory actions. You want to be involved in that, submit information, submit what research you have, what research you know about. So again, you can influence the process and bring your own expertise and information to bear. The third section is what we do day in and day out here at TFK, is translating, packaging, and disseminating research. This is really a large part of using research for advocacy. Translating the data, packaging the data for different audiences. So this section focuses on what you can highlight and again provides tips and tools for how to package research findings. For example, you want to steer clear of technical jargon or science language that a lay audience won't understand. You want to use local data whenever possible, and always keep it brief, highlighting key takeaways and messages. It's not enough to just like put the data out there. You really need to explain it and walk people through it in a simple way. So the next section focuses on conducting original research. Now, this might be needed when data is not available, or it's not going to be available in a timely way, when you want more localized information. This is all a time when you might consider conducting original research. And the guide includes some key considerations, what you want to think about before you undertake this. So it's like, what is the research question you're trying to answer? Will you be able to do that on your own with the data collection methods and the people that you have at your disposal? Who's going to collect the data? Who's going to analyze the data? How will it get packaged? These are all things to think through before you launch your own research project. You also want to think about, would it be helpful to partner with a research institution, with a researcher? This can be, they may have, just be able to do it more quickly. They also might bring needed credibility. So you want to sort of weigh, depending on who the audience is, will it be important to have a research institution tied to the research that you're doing for whatever reason, depending on the audience, whether that credible outside voice is necessary. And the last section focuses on building relationships with researchers. And this can be really enormously helpful to our advocacy efforts. Researchers provide important research findings. They lend critical expertise. And they can also be really important, particularly when we want to counter the industry on the tobacco side, where often, obviously the tobacco industry is a huge foe. They're always putting out misinformation, disinformation, and we create our own messages, our materials to push back against that information. But it can be really helpful to have respected, credible voice who's not seen as an advocate per se, but is, someone who brings science, brings expertise, and their knowledge to the issue. So that's a way where we have, where we've established relationships. On the U.S. side, it's really been, we have a cadre of researchers that we work to, that we go to, that are great allies and can help us when we need to craft responses and pull together materials. And so this section of the advocacy guide includes strategies for how do you do that? How do you even begin to establish relationships with researchers, how to reach out to them, how to connect with them. Like I said, practical guidance. So I'll leave it there. The real stars of the show are the case studies where we, like I said, we want to bring this advocacy action guide to life. And we've got some great case studies lined up this morning. I think we'll first hear from Munawar in his work conducting original research on a project in Pakistan. So I'll turn it over to you, Munawar.
Thank you so much, Mag. Let me just start with some of the context that we have from Pakistan to have some understanding about the background of this research. Pakistan, in fact, the non-communicable diseases there is a huge burden. And not only this burden is growing, but also it's a very costly burden, where nearly every third adult has a type 2 diabetes, and Pakistan is ranked top in the prevalence of diabetes globally. And the cost of obesity was estimated in 2015 was 2.6 billion US dollars. And in next 6 years, 2021, the diabetes cost was almost equating to the same amount. And sugar-sweetened beverages taxes are one of the evidence-based way to reduce its consumption and also reducing the risk factors of these chronic diseases. And other important aspect that would be very interesting to know that the beverage industry is a powerful player, and they have presence and the influence in the policy arena, a strong influence that they keep there. And then by considering this, advancing these policies, Global Health Advocacy Incubators partnered with Pakistan National Heart Association to advocate for increasing taxes on sugar-sweetened beverages. As a part of that work, Pakistan Health Research Council was engaged by Pakistan National Heart Association, which is one of the very credible research institute, and they have undertook this national level study to assess public acceptability of the SSB taxes. Why, in fact, we conducted this national opinion poll? The idea was to gauge the public support for SSB taxes and to generate some local data, and also to understand the public opinion on the key issue and test messages that can be used for an advocacy campaign. It's important that how public, in fact, respond to our messages and what could be a best way to telling about the problem and the policy change. And then also to use poll data to enhance earned media coverage, garnering attention to the issues. We have been able to sensitize a number of journalists, and it's always the journalists have an interest to the new data. And this was could be an opportunity. We thought that journalists would be interested to, in fact, showcase the new data and the public opinion to a larger audience. And then a very important that to build a confidence of the parliamentarians that their constituencies support the intended policy change. The politicians that are, of course, they if they hear the voices of their voters, that really that could build the confidence about the intended policy change that we were advocating. So that these were four major areas that we thought that this opinion poll can add value to our advocacy work. And when we saw the outcome of the poll and the results were like amazing. 85% Pakistani adults believe that the government should take steps to discourage consumption of SSBs. And there was a strong support for taxes. Nearly 78% Pakistani adults supported increasing taxes to SSBs to reduce obesity and non-communicable diseases. And the support for earmarking that tax to fund health and nutrition program was very high. The people were like, that shows that people want to tax the unhealthy food, and also that tax should be earmarked to improve public health and also improve nutrition. And as a next step, once we have these results, we used several strategies to disseminate these results for our advocacy campaign. The researcher, in fact, supported and arranging a high-level dissemination event with the journalists, policymakers, and the key influencers. And the key influencers also, we brought together the civil society, we brought together to health professionals, medical associations, religious leaders, and the social media influencers as well. And the results of the poll were incorporated into a policy brief, which our partners supported to Ministry of National Health Services for development, and then onward submission to Ministry of Finance. The Ministry of Health, in fact, submitted that policy brief to and the policy proposal to Ministry of Finance, and it's under Ministry of Finance and organization, a federal board of revenue that was responsible to collate all those proposals and then to add to the finance bill. The parliamentarians were sensitized on the poll results to build their confidence on supporting the policy change. We arranged several dialogue events and in-person meetings with the parliamentarians, where we have in fact sensitized them on what public is expecting from them and the support that public has expressed for taxing sugar-sweetened beverages. And that was, in fact, an idea originally, if the poll result could, in fact, help parliamentarians to build their confidence as well. And the key results continue to be highlighted through social media. We find that the social media is a very important tool, and that can, in fact, continue adding to that dissemination effort. And in addition, we also used earned print and electronic media to engage journalists and the journalists, those who were trained by our partners, and they supported and in fact, because these results were very attractive to them, that's a new data, and that they continued showcasing throughout the campaign, and that has really helped in creating a lots of impact. And can you move to the next slide? And the outcome of the entire effort was a great policy victory that our partner has achieved in Pakistan. Government of Pakistan decided to bring a supplementary finance bill in February 2023. And as a part of that, the federal excise duty on carbonated beverages were increased from existing 13% to 20%. And that was immediately effective from 1st of March. And in addition to that, there was a new tax that was imposed on federal excise duty on juices, syrups, squashes, and these products were previously not taxed, and that tax was also effective immediately. And after 4 months, we got another opportunity. The finance bill was presented in June 2023 in the parliament, and there was also another window of opportunity for us to strengthen the existing taxes. And during the finance bill, the federal excise duty that were in fact enacted 10% during the supplementary finance bill was further strengthened to 20%. And within 4 months, we had that second victory. But I want to highlight that the opinion poll was in fact one of the several multidisciplinary strategies used in Pakistan, which led to a successful increase to federal excise duty on SSPs. Thank you. I would now hand over to Julianne.
Oh, maybe I think before we move on, maybe I could ask a question if that's okay, Munawar?
Yeah, sure.
Really interesting, and congrats on the success there. I was curious about once the pollsters or the researchers conducted the poll, did they remain engaged? Like, did they help you? Did they compile materials that you used? Did you connect them with policymakers or journalists working on the issue? Or did they primarily do the poll and then hand the results over to the advocacy team?
Yeah, thank you, Meg. In fact, we engaged with one of the very credible research institute, that was Pakistan Health Research Council at that time. And they, in fact, designed the research, and they also, in fact, conducted that opinion poll, and a high-level dissemination event was also organized by them, where we have, in fact, invited policymakers, we have invited the journalists, we have also invited health professionals, and civil society and other key influencers as well. And then in addition, there was also like quite a high visibility, and like that information dissemination was quite, in fact, went across the country and covered by the mainstream media. After that, there was a series of dissemination efforts that were done, but primarily that were led by our partner, Pakistan National Heart Association. But wherever, in fact, we need the researchers' support, and if there was anything need to be explained, so the researcher was available to help us on that. And so these collective and collaborative effort, in fact, led us to that successful advocacy campaign.
Great. Thank you. That sounds like a great collaboration there. Good to hear it. So Shani, I think, are we going to hear from, yes, Dr. Anita.
Good afternoon, everybody. Good start. I would like to share a case study on the tiny target study that Zambia undertook at the end of last year. So the background goes as follows. In Zambia today, we know that 14% of Zambian youth use tobacco. In fact, in the last GYTS, the results indicated that 60% of children by the age of 7 have tried a tobacco product of some kind. And we know that tobacco kills over 7,000 Zambians on an annual basis. And we know we must protect young people from initiating smoking and becoming addicted. We also know that global tobacco companies promote cigarettes sales near schools to encourage young children to take up smoking. So what we did is we embarked on a big tobacco tiny target study. We surveyed 470 shops, kiosks, and other points of sale, all within 100 meters of a primary school, secondary school, a playground, or a game zone. In all health districts of both Lusaka and Chongwe. Lusaka and Chongwe we chose because Lusaka is an urban area, Chongwe is a rural area, and we wanted to do some data analysis of the differences between the rural and the urban areas. And all photos in this presentation were taken as part of the 2024 survey. So the summary of findings: tobacco products were available for purchase in 99% of the kiosks and shops surveyed during the study. Single cigarettes were sold at 93% of them. In fact, at some kiosks or shops, we even found promotions such as buy one, get one free on single stick cigarettes. Most cigarette brands on sale came from global corporations such as BAT. 80% of kiosks and shops displayed cigarettes near candy or at the eye level of children. Some of them even displayed cigarettes near healthy products such as vegetables. Posters, banners, and other advertising tactics were also observed at over half of the points of sale. And flavored tobacco products were sold at 55% of the shops and kiosks that we visited at the time. So our question: in the absence of a comprehensive tobacco control law, what has changed since the last big tobacco tiny target study in 2019? And the answer to this was advertising and promotional tactics were just as prevalent, and if not worse. More tobacco brands were being sold. At the time we were doing the study, on the tool, we ended up having to add so many other brands because that's what we found when we're testing the tool. New products like e-cigarettes were becoming more and more available, and this was not considered in the last Tiny Targets study. So our conclusion was, without a comprehensive tobacco control law in Zambia, big tobacco will continue to target children in Zambia and hook them onto tobacco. And our recommendations coming out of the study were, like Zambia, must protect children from tobacco and fulfill their promises or their obligations under the FCTC by 1, banning all forms of tobacco and nicotine product advertising, promotion, and sponsorship. By 2, by banning the sale of individual sticks. 3, by banning the sale of tobacco and nicotine products within a distance of 100 meters of primary schools, secondary schools, and to add on to this list, game zones and playgrounds. I would also like to share our experience, the experience that we had during the research, before the research, while we're doing the training. To date, this research methodology has been applied on dozens of countries. Recently, within the region, we had South Africa conduct this research. And by the time we were starting to do our own research, South Africa was just concluding theirs. And our colleagues from South Africa, more especially the youth, did come to Zambia to offer to build capacity and to train our youth data enumerators or data collectors on how to collect the data, and also just to share their experience, what they experienced in the field. So this was a great example of inter-country collaboration and capacity building that spills over to the next country. So South Africa were our big sisters in this. They held our hands right until we finished the research and wrote the report. Tailored to the context, this approach also enables us to maintain strong messaging and compare results across countries.
Thank you, Anita. That was great. I have a question, but I think there might be other questions as well. Please don't hesitate if you have questions for any of the presenters this morning, just drop them in the chat and we'll be able to share those. Shani, I think you also said you had a question, so why don't you kick it off?
Great, thanks. And thanks so much, Anita. It's great to hear about the research being done in Zambia and that it's young people that were actually part of doing that research. I know you've had some recent developments in the policy in Zambia, so I'd love to hear how you were using the research in that and what are the actual developments you've seen in Zambia?
Right, thank you. Thank you. Yes, it's important that I share that. It's very exciting news. As we probably know, our draft bill had been stuck at the Ministry of Justice for a little bit over a year. In the last months, we launched a pressure campaign, putting youth at the front, at the center of the campaign. And we used the messaging coming out of this research, the results coming out of this research in form of a fact sheet, basically to use this to drive the message and to use this to enhance their advocacy using recent locally generated evidence. And we saw last week, with the persistence of the youth, engagement of Minister of Justice with this information, engagement of Minister of Health with this information, and the public and the social media campaign, we saw that with all that pressure, we finally had our bill released from the Ministry of Justice, and we finally had our bill go through a third internal legislative committee meeting, and this time our bill was unanimously approved to move to the next stage. So we're one step away from Parliament, and this step can happen anytime, at least within the next 2 weeks to a month. And we are going to Parliament, and we'll continue to use the fact sheet. We'll continue to use the results of this research that we did to really, really, really push for the law and how important it is for government to protect the youth, protect the young people against the tactics of the industry. Thank you.
Excellent. It's so great to hear like this work happening as we speak, the research findings. And I know you have a fact sheet on there, and I'll share the screen with the fact sheet later on in the session so people can go and find that. Meg, back to you.
Yeah, thank you. Great. Anita, I was looking for, on Zoom, they usually have a clap hands. I was looking for that. I couldn't find it, but congrats on that progress. Definitely good news there, and great illustration of putting our research to work. I had a question. You had mentioned at the beginning that you collected photos, right? That photos that were part of your presentation were collected as part of the research project. And I wonder if you can talk more about how you may have used those. We find in our work on the US side, really having the data research is important, but when you can combine that with photos or personal stories, that really that storytelling can really be important and effective. And so I wondered if you might talk about how you package the photos with the research findings, with some maybe stories to help garner more attention, more support for the policy actions.
All right. Meg, you're absolutely right. A picture tells a million stories. And we did indeed use the pictures as part of the fact sheet. In fact, we just concluded the report, the entire report of the tiny targets, the study and the results. And I must say that half the report, if not more than that, is actually consisting of the pictures. We were able to take quite a number of pictures. Actually, it was quite a task to narrow down and to see which pictures we'll use, because all of them were absolutely brilliant. Yeah. All of them were absolutely brilliant. So basically, I mean, if you look at this, of course, because of ethical reasons, we couldn't really take the faces of the children, but it's really, really interesting to see these children, standing at kiosks in front of these huge advertising by the industry. And of course, pictures bring evidence to the fore. We've got a fact sheet. There's a QR code on the slide that is being projected, and the fact sheet can be accessed using this QR code. Then in terms of stories, because this was an observational study, we did not ask any questions. We have done stories as another part of our work, the human interest stories from beneficiaries of our work in Zambia, and we have used those. But for this particular research, we didn't take any stories because, as I said, this was a purely observational study, and we didn't speak during this study. Thank you.
Thank you. So now we're going to turn over to our next case study, and from Julianne Hopper. She is going to share some important work we've been doing on the US side on overdose prevention. So Julianne, over to you.
Hi everyone, my name is Julianne Hopper. I am the Program Associate for the Overdose Prevention Initiative here at GHAI, and today I'm going to explain to you how we used research and fact sheets to advocate for legislation. So to provide you all with some background information on this case study, our team is dedicated to reducing overdose deaths in the United States. We do this by directly advocating for evidence-based policies and engaging with Congress and the administration. As many of you know, the overdose crisis has had a devastating impact on Americans, with over 1 million Americans losing their lives since it began. The factors driving this crisis continue to evolve, and new drug threats emerge constantly. Policymakers often struggle to keep up and are overwhelmed by the toll that this takes on their communities. There's no single solution to this crisis, and that's why understanding the latest research and evidence is critical to identifying the most effective policies to support. When determining our advocacy priorities, we analyze key interventions and modeling studies to assess the potential impact of various policy changes. After careful evaluation, we decided to focus on advocating for the Mainstreaming Addiction Treatment, or the MAT Act. This legislation aimed to remove a major barrier to treatment, the X waiver, which is a special registration required for physicians to prescribe buprenorphine, a life-saving medication for opioid use disorder. The waiver process created an unnecessary bottleneck, restricting the number of healthcare providers able to prescribe this treatment. By eliminating the X waiver, the MAT Act would significantly expand access to care, making it easier to receive treatment that people need. To effectively advocate for this policy, especially given its technical nature and its reliance on data, we developed clear, concise fact sheets that highlighted its importance. These materials helped us communicate with policymakers and build the case for action. Okay. So, when developing your fact sheet, to develop persuasive fact sheets for the bill, we relied on up-to-date, trusted data sources to ensure accuracy and credibility. First, we highlighted the local impact of the overdose crisis by presenting data specific to each congressional district. Using CDC data, we provided members of Congress with overdose statistics from their own states and counties. This approach made the crisis more tangible, rather than just citing the national figure of over 100,000 overdose deaths per year. We localized the issue to emphasize how it directly affects their constituents. Next, we incorporated a Department of Health and Human Services, or HHS, Inspector General report that detailed the nationwide shortage of buprenorphine providers. This report included county-level data and an interactive map showing areas with the highest need for treatment access. By tailoring our fact sheets to reflect the provider shortages in each policymaker's district, we strengthened our argument that policy change was urgently needed. Having government-issued report as evidence gave our advocacy efforts greater credibility. Additionally, we included a Joint Economic Committee report that analyzed the fiscal impacts of the opioid crisis, estimating its cost at $1.5 trillion in 2020 alone. Demonstrating the economic burden of this crisis helped us to appeal to fiscally minded policymakers, showing that investing in solutions like increased access to treatment could lead to significant cost savings by reducing overdose deaths and connecting individuals to care. By combining trusted data, localized impact, and economic arguments, we crafted fact sheets that were compelling and evidence-based and tailored to resonate with different policymakers. So, once we gathered all of our relevant data, we created fact sheets that clearly laid out our advocacy story. Each fact sheet followed a simple but powerful structure. It laid out the problem, which was the overdose crisis. It highlighted a key cause, being the X waiver, which limited buprenorphine prescribing, and it provided the solution, the MAT Act, which removed this barrier. These fact sheets transform complex research into a compelling and digestible format, allowing policymakers to quickly grasp the urgency of this issue and the real impact policymakers could have on their districts. To maximize impact, we personalized fact sheets for every office that we met with, which was over 100 congressional offices, including this example tailored for a representative from Alaska. By providing lawmakers with district-specific data and evidence, we helped them make informed decisions, and as a result, we secured a large number of co-sponsors for this bill. While the fact sheets were just one piece of the broader advocacy strategy, they played a crucial role in passing the MAT Act, which was signed into law in 2023. Beyond this policy victory, these fact sheets helped us build long-term relationships with policymakers. They positioned our team as a trusted, data-driven resource, a role that not only advanced this campaign, but also strengthened our ability to influence future policy decisions. This case study demonstrates the power of being an information resource. for policymakers. When research is translated into a clear, compelling narrative, it doesn't just inform, it drives action and helps achieve advocacy goals. Thank you for listening.
It's about like how decision makers responded to having such tailored fact sheets provided to them.
Yeah, so this is an example of one that we tailored specifically to an Alaska congressperson, so giving them the data for their state specifically. And then if we knew that they had more specific interests, such as in the workforce, or if they cared a lot about pregnant populations, or they cared a lot about, or they had a large population of American Indian, Alaska Native people in their state, we would tailor a fact sheet specifically to that, showing the impact that this legislation would have on certain populations or areas that they cared deeply about. So tying legislation through research that shows how scoping of an impact that specific bills would have is really important, and again, personalizes that data and kind of builds a story and shows the scoping impact that policy change could have. Hopefully you could hear that.
Yes, we could hear that nice and clearly. Meg, did you have a follow-up question for Julianne?
She actually covered my follow-up question. I'm trying to think. I love the map. I'll just say that having that data in the map can be so powerful, and the fact that you were able to pull it together by congressional district is really amazing. I want to echo what you said about tailoring it to people's interests. I mean, I think that's where advocacy for action, the research doesn't exist on its own, right? We're not just some off in the corner. We have to talk to our colleagues, talk to our advocates and lobbyists. And from talking with them, you understood that American Indian, Alaska Native information would be particularly important for, ex-congressperson, or, on the tobacco side, we learn similar things. What are key demographics for different legislators? The economic issue is always really important. Could you talk a little bit more about, I may have missed this, I think you also combined the data with some economic information, which is always something that we look to do. We never have enough data about up to date. Some of the data are outdated that we use, the healthcare costs, the impact on costs, and then the savings that would accrue. So if you could talk a little bit about the economic data that you brought to bear to help your issue.
Yeah, so on this fact sheet specifically, we used an economic report that showed the cost of the overdose crisis. And so the way that we kind of use that is if the number of lives that are lost doesn't sway a policymaker, maybe they'll be swayed by the cost and maybe they'll care about that. And so it's hard to put a cost to human life, but it is something that policymakers consider. And so when we say that having an overdose and somebody having to go to the hospital and the government having to pay for that, that's going to cost hundreds of thousands of dollars. So what if we could prevent that by giving this person treatment or providing them with resources so that they're not overdosing? And that can be a convincing argument for some policymakers if that is what they care about, and if they care about the cost of healthcare in this country. So yeah, that's been effective. We found that to work more for some offices than others. And it's definitely a tool that researchers have, is to look at the cost benefit of certain interventions.
Fantastic, Julianne. I've got a question for all three of you, and that's really around kind of who is delivering this research message or this research data. One of the things I think we know about advocacy and the work that we do is that we really have to find trusted messengers to deliver these research findings, that sometimes we're welcomed by the decision makers, but other times we don't necessarily have access to those decision makers. So, maybe starting with Munawar, what kind of messengers did you engage to support in sharing these research findings with decision makers? And then maybe we'll go to Anita and back to Julianne.
Yeah, thank you, Shani. I think this is very important because once you have the research and there are people, those who you could find a messenger, but the messenger could also find a research to disseminate. And one good example was that the Ministry of National Health Services used that research, included that as a part of their proposal for finance bill that was sent for increasing taxes on sugar-sweetened beverages to Ministry of Finance. So there was one example. And other than that, there were like we engaged with the journalists, we engaged with the social media influencers, and also parliamentarians, and then we reached out to peer parliamentarians from those who were sensitized on that. So this actually developed a chain of information, and like it actually moved from through media, through ministries, through parliamentarians, and it continued moving to the actual policymakers and those who are actual decision makers, because the finance bill is one of the very tough debate that occurs in the country, and the Ministry of Finance and the finance minister, prime minister, and everyone is involved into this decision making. So in fact, but more importantly, if you find some champions for communicating these messages to the key decision makers, that always helps. You have research, you have messages, and then it's more important to connect with the actual decision maker through your champions. And that's one of the most important aspects that we also explored during this advocacy campaign, and it ended up on a successful policy victory.
Fantastic. Anita, could you talk to perhaps the misinformation also you were having to face? You had your messengers, but you also had the industry pushing its own agenda in this manner.
Yes, of course, Shani, the industry has been pushing hard and is still pushing very hard. But when you look at the Zambian population, the Zambian demographics, you find that 65% of the population is the youth. So who matters to the politicians? It's the youth. They'll get their votes from the youth. So we use the youth to carry this message. We use the youth to take this message to the policymakers, because the policymakers, the politicians, really, really, treasure the youth, because the youth are what put them there in the first place. So the youth were number one. We also disseminated to the journalists, our association of journalists who are particularly trained in tobacco control, to report on tobacco control issues. And this has been carried from the journalists into the media spaces, be it traditional media, be it social media. So those are the channels that we've used so far.
Excellent. Thanks so much for that, Anita. Julianne, I know the Overdose teams use some really unusual champions in sharing your messages. Could you speak to that a little briefly?
Yes, so we know, again, localized impact is really important for Congress members. So a lot of the time we will have partners in different states who have on-the-ground experience of how the overdose crisis is impacting their states. And we can give them these fact sheets and research and talking points to help equip them to talk to policymakers to make a change on this. And also finding different types of partners, such as maybe law enforcement, who have on-the-ground experience of how this crisis is impacting their states and their districts. So finding different sectors of people who can speak to different parts of this issue has been really important for our team.
Excellent, thanks. I mean, thank you to all of you. You know, we really value, and we know that decision makers value credible evidence-based information to help inform their policy work. And I think you've all three, as well as Meg and her experience with the US domestic tobacco, have shown different examples of how you've been able to go out there, collect data, collect information, and sometimes, in some cases, your own original research, to make it available to decision makers so that they are making decisions that are based on evidence. They know what the impact is on their communities, and we can really seek that sustainability that we get from local evidence, but bringing that together with kind of global research findings and trends in other places. So thank you so much for your case studies today. Any other question, Meg, before we move on?
I was just looking, Shani. It looks like yeah, thank you to the group. There looks like we did get one question in the chat. Trying to break it down here. Yeah, I mean, I think someone is asking about how to communicate around taxes, given the complex structure of taxes. And I think how sometimes our messages can be complex or the research can be complex. How do we kind of deal with that? I think is the general gist. I'll take that one real quick. I'll just say that yes, when we're dealing with policymakers, for the most part, we generally try to not get too in the weeds, right? At first, it's really keeping it simple. We focus on the problem, the cause, and the solutions, right? The problem being the high use rates. The cause is often the industry promoting the products, and the solution in this case would be what we're talking about is tobacco taxes. And so really showing the research to bear simple findings that increasing the price reduces access, particularly for young people. And now when we're talking about getting into the most legislators don't need to know the details about tax structure and how it works per se. Those details will come more when you're maybe dealing with health and finance industry agencies. And then I think we would expect to be able to go into a little bit more depth about how it would work. And we would work with our researchers. We have folks on staff who are experts. But again, not really get just enough detail and complexity that's needed to answer the question directly, but not overwhelm them with too much of the intricacies of the tax structure would be particularly if you're dealing with a legislative body. The intricacies might come more, like I said, when you talk to the finance ministries, or the folks who are really involved and have some level of knowledge themselves about tax structure. So I hope that answered the question. I don't have any other questions. I do want to thank the panel as well, Shani. I think great examples, different examples of bringing research to bear and on different policy issues.
Yes, thanks to everybody. I'm trying to get you to the last page. I'm failing miserably. Apologies all there. Thanks to everybody that's joined us today. Thanks to our panelists and for the participants. In the bottom right-hand corner, you can see our website. At that website, you'll be able to download the whole guide, the Research for Advocacy Action Guide, which includes these case studies, as well as many more. It includes a lot of guidance as per the 5 areas that Meg identified, as well as some resources and additional references that may be helpful as you continue your journey in advocating for public health outcomes. Thanks to everyone. Please do reach out to us if you have questions. Our website has got quite a lot of resources and information. We encourage you all to explore that. And thank you again for your participation. Have a wonderful day.